statins, we have ezetimibe, we have pemvidutide acid, we have other PCSK9 inhibitors, and we have inclisiran. So how low you can go? The problem with Indian population, we all know that Indians have a very high risk for cardiovascular risk and experience a very early cardiovascular events when you compare with your Western counterpart. And it has been very clearly shown from the very early studies which are there for LDL cholesterol and cardiovascular risk that elevated LDL cholesterol is linearly related to cardiovascular risk. Every millimole per liter reduction, that's around 39 mg per dl reduction in LDL, is associated with a large 21% reduction in the major cardiovascular events. That's the reason every one of us is very much interested in reducing the LDL cholesterol. The problem is how low you can go. And the guidelines are changing every day. We know there are times when LDL cholesterols were given as a normal value of 130. When the time came, people started talking about 100. Now we have guidelines across globe which are coming with a very aggressive reduction in the LDL cholesterol level. If you look at 2023 ESC guidelines, when they look at patients with a high atherosclerotic cardiovascular risk, they're looking at a LDL level as low as 40 mg per dl. That's if you have a second event within 2 years, you can consider bringing out LDL as low as 40. If you look at 2022 ACC expert consensus, if you have a clinical atherosclerotic cardiovascular disease, which is very high risk, then you can consider LDL to less than 55. And if you have a patient who has a recent coronary events, you can consider bringing it down further. If you look at Lipid Association of India guidelines, it looks very, very aggressive. When you have a very high cardiovascular risk, they give you a number as low as 50. When you have an extreme cardiovascular high risk category, then you can consider to go down below 50. And if you have a risk category, they are divided into two categories, category A and category B, depending on the risk factors. You can go as low as 30. And there are patients who are really very high risk for recurrent cardiovascular events. There you have been given a target as low as 10 to 15. We know very well it's very difficult to achieve these targets without having a significant safety issues. The problem is, a lot of times what we think is when we lower a LDL level, there may be some secondary side effects which have been maybe told by the previous studies. Now we have a very large study, which is a 4-year trial, which included around 26,000 patients, where the cardiovascular benefits of lowering the LDL as low as 10, with a follow-up of over a 2.2 years, they could hardly see any serious side effects to consider this as a barrier to reducing the LDL levels. That's the reason a lot of us are becoming very aggressive about treating the patients with high LDL cholesterol and try to lower the LDL level.